Oh man, oh man, oh man. I'm gonna tell you what, I found this motherfucking article right here and I was like, dude, y'all motherfuckers gotta see this shit. Study Medicare for all projected to cost 32.6 trillion. That's trillion with a T. And that's over the next 10 years. Now, I told y'all in previous videos that, fucking, we spend $3 trillion a fucking year on fucking medical costs anyway to begin with, right? But here's the thing. Our total tax base is fucking $3.5 to $4 trillion a fucking year. So at 32.6 trillion for 10 years, that's 3.2 trillion fucking dollars a fucking year. That's the entire federal fucking tax base, right? I'm going to read you this article from ABC News. It says Senator Bernie Sanders' Medicare for All plan would increase government and healthcare spending by 32.6 trillion over 10 years. According to a study by university-based Libertarian Policy Center, that's with a T. The latest plan from the Vermont Independent will require historic tax increases as the government replaces what employers and consumers now pay for health care, according to the analysis being released Monday by America's Center for at George Mason University in Virginia. It would deliver significant savings on administration and drug costs, but increased demand for care would drive up spending, the analysis found. In other words, all of us who ain't fucking using the goddamn service because we don't have it, we would start fucking using it because, fuck, we're goddamn paying for it. Might as well get everything fucking fixed. You know what I'm saying? Like all this shit that's wrong with us, and we just like, fuck it, we'll work through it. Nope, not going to happen anymore. You're going to end up going to the hospital and getting shit squared away. Sanders' plan builds on Medicare, the popular insurance program for seniors. All U.S. residents will be covered with no copays and deductibles for medical services. The insurance industry will be relegated to a minor role. Enacting something like Medicare for all would be a transformative change in the size of federal government, said Charles Blauhaus, the study's author. Blauhaus is a senior economic advisor to former President George W. Bush and a public trustee of Social Security and Medicare during the Obama administration. According to the study, Sanders took aim at the America Center, which receives funding from the conservative Koch brothers industries. And Charles Cox is on the center's board. Let me be real with you. Charles Cox has no skin in this game. Like, he has nothing that's really going to fucking be affected by this. So it is what it is. If every major country on earth can guarantee health care to all and achieve better health outcomes while spending substantially less per capita than we do, it is absurd for anyone to suggest that the United States cannot do the same. Sanders said in a statement, this grossly misleading and biased report is the Koch brothers' response to the growing support in our country for a Medicare for All program. Sanders' office has not done a cost analysis, a spokesperson said. However, the America's... Yo, look, how do you propose something without knowing how much it's going to cost? All right, that's like saying, hey, baby, I'm going to tell you what, I'm going to buy you motherfucking a house anywhere you want to, without even thinking about how much a fucking house costs. Like, are you fucking retarded? Like, are you the dumbest motherfucker on the planet? Like, how are you gonna fucking stand here and not do a fucking cost analysis of how much it was gonna fucking cost before you started telling people it wouldn't cost that much? Motherfucking you goddamn retard. All right. Sanders staff found an error in initial version of Maricat's reports, which counted the long-term care program that was the 2016 proposal, but not the current one. Blauhaus corrected it, reducing his estimate by about $3 trillion over 10 years. It's cool, you know what I'm saying? Like, yo, fucking, he corrected his shit. You know, when they said, hey, look, the numbers that you got aren't quite right? But it's $3 trillion over 10 years. That's still $29 trillion, right? Blauhaus says the report is his own work, not the Koch brothers. Also called single payer over the years, Medicare for All reflects a long-time wish among liberals for a government-run system that covers all Americans. Go away, motherfucker, right? The Maricos analysis estimated that a 10-year cost for an overall program from 2022 to 2031 after an initial phase-in findings are all similar to those in several independent studies of Sanders' 2016 plan. These studies found increases in federal spending over 10 years that range from $24.7 trillion to $34.7 trillion. And nobody sees a problem with this? No one sees an issue with this. Kenneth Thorpe, a health policy advisor at the Emory University of Atlanta, authored one of these studies and said, Meritos analysis reinforces them. It's showing that if you're going to go in that direction, it's going to cost the federal government $2.5 trillion to $3 trillion a year in terms of spending, said Thorpe. Even though people don't pay premiums, the tax increases are going to be enormous. There are going to be a lot of people who pay more in taxes than they save on premiums. Thorpe was a senior health advisor in the Clinton administration. Mercatus study says it takes issue with the key cost-saving feature of the plan that hospitals and doctors will accept payment based on lower Medicare rates for all their patients. The study found that the plan would reap substantial savings from lower prescription costs, $846 billion over 10 years. Over 10 years, since the government would deal directly with drug makers, savings for the streamlined administration will be even greater, nearly $1.6 trillion. Over 10 years. Over 10 fucking years. But other pavilions, like, yo, even if you're talking $2.7 trillion a fucking year, that's twice what we spend on just the whole government in general. Like, yo, the majority of what we spend on government is Medicare and motherfucking Social Security, right? Like, each of those every year are like 1.1 and $1.3 trillion dollars, right? So the rest of the government, you know what I'm saying? Like, fucking the other, like, what is it, $1.4 trillion is just regular government shit, including the military. You're talking about quadrupling the size of the goddamn government. But other provisions would tend to drive up spending, including coverage for nearly 30 million uninsured people, no deductibles and copays, and improved benefits, including dental, vision, and hearing. After taking into account current government healthcare financing, the study estimated that doubling all federal, individual, and corporate income taxes would not fully cover the additional costs. Anybody else hear that shit? I'm going to say it again. Doubling all federal, individual, and corporate income taxes would not fully cover the additional cost. You motherfuckers are dreaming. Stop being fucking retarded. It's the dumbest shit ever. Bernie Sanders is a piece of shit, Jewish cocksucking liar. Get it fucking right. This is Tom Pease with P Noid News. Later.